So I will start off with, so we have our app, which is called Mind Yourself. And Mind Yourself, we have a small core team of psychologists that are just incredible and all bring very different stuff. So together we have over 40 years of either leading, researching or working within the mental health field. And so a lot of the app is a huge amount of love, experience, and our expertise that have gone into creating it. Next slide, please. So we have a very big mission, very ambitious mission as well, where we want to prevent the progression of mental health challenges in 50 million health and social care workers. And maybe a little bit about how this came about. So when COVID hit, like lots of other people, I was really moved to do something to use my skills to help. And so set up free drop-in services, sessions just on Zoom, where any staff member could come for free and share how they felt, and I would offer ways for them to navigate, understandably, really harrowing circumstances. And from that, then they asked, oh, could you create some things that we could maybe print out and give to other staff, which I done. And then I wanted to reach more people, so started to write the books. And then wanted to reach more people. We started to launch national programs and started to really support thousands of staff to really help them understand and navigate. And I guess skill, I really love what Radha was saying there about, you know, they're not personality types, they're skills that you learn. And so really supporting people to learn those skills. And so 2 years ago, while having a conversation, I was like, let's create an app, which is so ironic, Sue, because I'm the least tech person ever. On off is the extent of my ability. So hence why we've some amazing people who are really supporting us in this venture. Next slide, please. So what we have learned and what a lot of the evidence and research has shown is that, you know, particularly across health and social care at the minute, there is a significant issue with retention. And we know that if someone has had 2 mental health related absences, that they're 60% more likely to leave their profession, which is massive. But also we know now the tipping point that staff now take more time off due to mental health related absences than they do because of COVID, and the impact that that has, not just financially, but also on service provision and the ripple effect that that has more systemically then on staff. And certainly within our practice, we're hearing more about the human cost. It's, you know, it's one thing for sure, which is important to be able to quantify these things through number of days lost and the financial impact. However, when staff aren't able to do the job that they love, or they fall out of the job that they love, and that tipping point of what is your usual amount of stress then reaches a point where you feel like you can't carry on either in your profession, or you're starting to think and plan suicide. That is for us the massive driver in a part of what is behind the app. Next slide, please. So we feel like the solution to this, part of the solution to this is the app. So this is the first app out there that prevents the progression of mental health symptoms in health and social care workers. And as I say, the last 2 years have been a massive learning curve for me in particular, in this tech space, because what we are asking is that organisations buy it for their staff and gift it to them. And actually some of the research that we've looked at and conducted is massive, two massive barriers actually that interfere with staff reaching out for support is the stigma of mental health across health and social care, and also the fear that it will impact on their career progression as well. So whenever then a staff member receives the app, we don't track it in any way. It's all completely anonymized. So we can't then go back to a trust and say, okay, Jan has been using the app, she's been using these areas in it. So it being anonymized and us not collecting the data around that is one of the benefits. Also, we have created a number of tools. So you can see here, it's an example of some of it. So things that directly will prevent the progression of things like anxiety, managing low mood, trauma, how to create positive mental attitudes. Sleep is managing sleep as well, which is, I guess, a more universal symptom whenever our mental health is being impacted. But also, over the years, the one thing that staff will share with me is when I say to them, look, let's look at how you can support yourselves, how you can support colleagues. They're like, Jan, can't even do the jobs on our list, never mind, look after ourselves. So there are things in there which is short on time. And so that's divided into things that you can do under 5 minutes, things that you can do under 10 minutes, and things that you can do under 15 minutes, which are all evidence-based tools that really, really can support you and contain you. So for example, if you are someone who are a newly qualified or not, and you've maybe been involved when care hasn't gone as expected, you're going to have a response to that. It's expecting you're going to have a response to that. And so the ideal scenario is that you go home, that your shift ends there and then, and you go home, and support then will be put in place to support you following that event. However, in reality, what we know is some people maybe get an extended break and they have to carry on. And so what you would do then is you would use the Mind Yourself app to go in and do some of those tools to just help you regulate and calm your nervous system, which understandably will be firing on all cylinders. And it will mean then that will support you to hold and contain and regulate so that symptoms don't manifest and progress into something else. You will still have a reaction. It's perfectly expected that you will have a reaction. So these are ways that you can use to really help you. Also, we know that women and those from diverse ethnic communities and newly qualified across health and social care space are most impacted by mental health. And so we've things in there specifically around supporting those groups of people. So things around how you navigate perimenopause, menopause, what's it like being newly qualified and entering that space, with Radha saying it's anxiety provoking for sure. You'll have imposter syndrome. 20 years later, you'll still have imposter syndrome. It's just you'll know it a bit more and you'll be able to navigate it a bit differently. You know, so there's things in there that are specific for health and social care. If you've encountered workplace violence, so we know that unfortunately there are professions like those working across A&E and paramedics and those working in ambulance services, including midwives in that space, who are more likely to experience workplace violence. And so there are situations that coach you along those. So how do you navigate that? What's that like for you? And those situations are specific for health and social care workers. Next slide, please. So the app is also personalized. So what will happen is you will be invited to fill out a questionnaire, which is just, it takes, I think, 3 minutes to fill out. And then you'll be presented with this pie chart. And so it'll break down each of those segments into what it says that you should, it suggests that you do. So for example, you maybe have a portion of that is anxiety. So it might then suggest, okay, these are the things that you might do to support yourself with anxiety. If you're total novice to doing anything related to your mental health, it guides you through it. So there's a sort of beginner, a more intermediate if you have some experience, and then a more advanced if you're like, yep, I'm totally au fait with all of this stuff. And so it builds up and it coaches you and it builds those skills to help you feel more resourced when you need it the most. So what Mind Yourself is aiming to do is across 4 areas, which is to support retention, reduce those number of mental health related absences and clinical errors, and also improve service provision because staff are mentally healthy. And you know, and Sue and I, you and I have talked about it before, you know, that big massive gap there is, although we say reach out when you need support, and of course that narrative is really important. There's also something about we all work in a team, or we all work in a profession. If you're not in a team, do you know, and there is something about reaching in. So a large part of the app as well is, how do you reach in? How do you ask those difficult conversations? If you've noticed that someone just isn't themselves, or they're maybe a bit avoidant, or they're maybe saying, yeah, I'll meet you, but don't turn up. So things that mightn't look typically like mental health, and mental health is on a continuum the same way our physical health is on a continuum. So this is about trying to support people and do that of reaching in so that we all can care and look after each other. So also within the app is trying to build and develop that community of peer support for one another. Next slide, please. So we know that globally there are currently 234 million health and social care workers, and there are 30 million of them based across the UK and the US. So where we are really targeting is NHS trusts, social care organisations, and also universities, so that you know, I really love that analogy, Radha, that you shared around having the seed and having the right soil. And I really love that. I think I'm probably going to steal that at some point. You will be cited, of course, around just, you know, students are our future leaders. If we don't invest in them and support them and really invest in giving them the skills that they need to navigate a career that they love and stay in it and love it while they're staying in it, then we're setting them up to fail. And so our mission is really to drive across those three sectors to support people. Next slide, please. So there's lots of mental health apps out there for sure. However, there isn't any app that is out there specifically for health and social care staff, and that provide tools that you can use while you're on shift, while you're walking down the corridor and beyond. And they're a combination of those evidence-based experiences and practices that we have across acceptance and commitment therapy, dialectic behavioral therapy, and cognitive behavioral therapy. So we've really pulled them together, so it's a very practical resource that people can use and draw on when they need it the most. Next slide, please. That's us. We've got a website where you can go and look at it some more and have a play around with it. We're also doing some trials, so if you want to be part of a trial, please reach out and we can share that with you. And we're really just on a mission to support and offer this as a resource for those who need it the most.